Welcome to my series, How to Fix Your Abs. I'm Dr. Wendy. I'm a physical therapist. I've taken care of women for 20 years, and I've done 2 studies on diastasis recti, one on normal mortals and one on people with EDS, both using the same protocol. Fun fact, the way I rehab EDS patients is very similar to postpartum because they're both stretchy people. And they both require exercise. Okay, so let's get down to it. So here's the deal. Women care about their strength, but they also care about what they look like. And honestly, after talking to women, a lot of times, one of the greatest things they care about is what their abs look like. When you have diastasis recti, the thin linea alba, that thin little white fascial strip between the 2 rectus abdominis bellies becomes stretched, lengthened, tensioned, and that's okay. When you were pregnant, that was like your turkey timer popping out. It has a function to serve your pelvic floor. So it's okay that you get that separation between the 2 abdominal muscle bellies. That's all right. Don't stress, and sometimes, not a lot, okay? Not a lot, not everyone. I basically assume everybody has to do ab rehab. Sometimes it will spontaneously heal. But I have to tell you, you have gone through a trauma and now we have to rehab you. And so doing abdominal strengthening is wonderful for all people. It is pretty rare that you see someone who has too strong of abs. And it's a foundation for so many other things. So you can't go wrong. And it is never too late to rehab your abs. So step 1, I'm gonna blow your mind. The first thing I need you to understand is your breathing matters. When you were pregnant, that baby took up space and made your ribs go out. This is what some people call a rib flare. And this is sometimes what bothers women because they really feel wide in their waist, and women don't like feeling wide in their waist. So there's this rib flare that's happening because the baby took up space, the ribs are out, the linea alba's stretched and distended, the abs are over here like not firing. And one of the first things I want to tell you to do is I want you to practice breathing, taking 10 breaths, lying on your back. Let's put your hands on your lower ribs, and I'm gonna have you take a breath in and all the way out. And as you exhale, those ribs are gonna go down and in. So when you practice this lying down on your back, it's actually a great thing to know that the first thing you did when you came in this world is to breathe, and the last thing you do is breathe, and the first thing we're gonna do in this rehab is breathe. So I know you're busy, but when you lay down tonight, when you go to bed, I want you to practice taking 10 breaths. You take that breath in and your lungs fill up with air, and then when you exhale, drop your ribs down. Fun fact, in both of my studies, the greatest verbal cue I gave my patients that they said that stuck in their brain was to drop their ribs. So stop living out here in this extended flare and so putting your hands on those lower ribs. All right, step 1, follow along for step 2. Bye.